GeneFolio gives us the means to reduce time-consuming trial and error. It helps people experience relief sooner. We are lucky to have it available at this low cost, states Matthew Stanley, doctor, in the article. GeneFolio helps with a wide range of challenges. What is this so-called GeneFolio? Is it effective? Does it really save a significant amount of time? These are questions that many people will ask about genetic testing. And you may be surprised by the answers you can get from these tests. Genetic testing is great news for anybody looking into a future surgery, pregnancy, mental health issue, cancer, and even more. What is GeneFolio? The answer to that being fairly easy. GeneFolio is just Vera's genetic testing program. Now the question arises, what is genetic testing? Genetic testing is the study of chromosomes, DNA, and the mutations that have occurred to that DNA. But it gets even more specific than that. Stated in the U.S. National Library of Medicine's article, What is Genetic Testing? Molecular genetic tests look at short strands of DNA to find mutations that can cause disease. A prime example of this is when they look for cancer-causing mutations in a patient's DNA. Biochemical genetic tests look at differing chemical problems in a sequence of DNA. It is used to see the results of some medications on the body. These are the tests that tell doctors the effectiveness of medications and how it will be metabolized in a patient's body. With there being many different things these tests can tell doctors, we're going to focus on two of the biggest things the tests look into: cancer markers and a personalized medicine. A lesser known fact is that some cancers are caused by genetic mutations, and they can be passed down from a parent or grandparent. Now this means that they are detectable in a test environment. Typically, if you have a parent or grandparent that has had a rarer form of cancer, they will have you take this test to see if you're carrying a genetic mutation for it. These tests are done with a lot more rare forms of cancer, such as breast cancer in men or retinoblastoma. According to Stacy Simon in her 2018 article, Should You Get Genetic Testing for Cancer Risk? From cancer.org. Knowing the results of these tests, they can decide whether or not to take preventative action. In this case of breast cancer, they could perform a mastectomy before the patient had any symptoms. This means that they would remove all breast tissue and you would receive implants. Genetic testing is an effective way to prevent some rare form of cancers. Medications have varying strengths for each person. They can also have differing side effects, depending on the person. This is why they use genetic testing as a way to find the most effective medication for a patient. Blood is drawn and then tested against several medications to find its best fit. That's all I have.